I'm Dr. Burkhalter. I'm the veterinarian at the Sea Turtle Hospital at the University of Florida Whitney Lab. Did you know that vets can take care of many more species than just dogs and cats? Well, I'm lucky enough to be a vet that takes care of sea turtles. And today I would love to take you on a journey of our hospital and introduce you to some of the patients that we take care of and the problems that they have. And then we'll teach you about things that you can do to help take care of the sea turtles as well. So come with me. Let's walk this way into our treatment room. As we enter, you will notice that it looks very similar to other doctors' offices. This is the room where we perform all of our medical treatments and patient care. While we don't have time to discuss everything we do here at the hospital, we'll definitely take a look at a few of the most common things. All of our turtles receive frequent physical exams to monitor their overall health progress and identify potential new problems that may need to be addressed. We administer a variety of medications, such as IV fluids, antibiotics, pain medication, vitamins, and nutritional supplements. Our turtles require a lot of wound care, mostly for various infections, injuries from boats and predators, and post-operative incisions. When our turtles need bandages, of course they have to be fun. I bet you didn't know that a sea turtle's favorite holiday is Halloween. Much like other hospitals, we perform a variety of procedures. Some include X-ray, ultrasound, endoscopy to assess internal organs, critical FP research, and many different surgeries, including laser surgery to remove fibropapilloma tumors. And of course, there's always time for a few snuggles. Okay, now let's go meet some turtles. Come with me on a walk out onto the deck. Each of our turtles live in separate tanks filled with fresh salt water that is piped in directly from the ocean. Each tank has its own filtration system to help keep the water clean. Our patient board helps identify which turtle lives in which tank and when certain maintenance needs to be done. Our awesome staff and volunteers work hard every day to keep their tanks clean and healthy. The first patient I'd like to introduce you to is Eugenie Clark. Eugenie is a female, which means girl, juvenile green sea turtle that came to us about a month ago. I don't know exactly how old she is because there's no way to tell that on sea turtles, but we can make an educated guess based on her life stage and current size. It's tricky though because sea turtles grow at different rates based on how much they eat, so sometimes their size is misleading. But we definitely know that Eugenie is a juvenile, which means she's a kid, and she's probably about 3 to 4 years old. Eugenie is being treated for fibropapillomatosis as well as a fishing line entanglement around her front flipper. Fibropapillomatosis is a crazy, big, fun word that describes a disease that we focus on here at the Sea Turtle Hospital. Fibropapillomas, nicknamed FP, are tumors caused by a herpes virus and many other complicating factors. Juvenile green sea turtles are the most susceptible because they are young with immature immune systems and they live inshore along the coastline and intracoastal waterways. These more shallow areas have warmer water temperatures and pollution from fertilizers and other chemicals, all of which contribute to fibropapillomatosis. The FP tumors grow around the eyes, shoulders, flippers, and other areas. You can see several of Eugenie's tumors here around her shoulders. As the tumors grow bigger, they make it hard for the turtles to see and swim. FP tumors are removed using carbon dioxide or CO2 laser surgery, as you can see here. On average, each turtle undergoes about 4 surgeries during their time in the hospital. It's too painful and too dangerous to remove all the tumors at once. Instead, we perform smaller surgeries and allow about 1 to 2 months healing in between each procedure. Eugenie has had 3 surgeries thus far, and as you can see, is doing very well. I'm sure you're wondering what that blue thing is in Eugenie's tank. That is her kelp forest that we built for her. It's like a toy that we use for enrichment to help keep her from getting bored. It's made of PVC pipes and car wash material, and it mimics the seagrass beds that turtles love in the ocean. It gives her something to brush up against, swim around in, and hide out to feel a bit more like home. In addition to FP, Eugenie had a second problem of fishing line entanglement. This is another very common injury that we treat in sea turtles. She had fishing line tangled around her flipper. This can sometimes be very serious, as we will discuss later, but in her case, the line was not very tight, so luckily it did not cause too much damage. We were able to remove the line, and as you have seen, she's swimming happily with 4 healthy flippers. The next patient I would like you to meet is Edward Scissorhands. Edward came to us back in October. He also has fibropapillomatosis and was very buoyant, which means he was floating and unable to dive. We don't know yet whether Edward is a male or a female because we have not performed the endoscopic procedure necessary to find out. Edward is a juvenile green sea turtle, approximately 2 years old. As you can see watching Edward swim, he's very buoyant, staying near the surface and unable to dive or stay underwater. His underwater headstands are definitely not normal swimming behavior. There are many different causes of buoyancy disorders. In Edward's case, he is floating because he has way too much gas in his intestines. When he was rescued, we discovered that Edward had a belly full of plastic. When turtles eat plastic, their bodies can't digest it, and so the intestines produce extra gas. This gas blows up their intestines like balloons, which makes them float. We can see on X-ray the excess gas bubbles in his intestines around pieces of plastic. So why in the world would turtles eat plastic? Seems kind of silly, right? Well, there are several good reasons why. The first is that some plastics, especially plastic bags, look like turtles' food when it's floating in the water. Here is a plastic bag floating in the water next to a jellyfish. They look pretty similar, don't they? And to make it even more confusing, while in the ocean, the plastic absorbs the oils and odors in the water, so it begins to smell like fish. As you might imagine, this belly full of plastic and gas is quite uncomfortable for Edward. The saying is definitely true, that turtles don't do anything quickly, so it will take up to 1 month for Edward to completely pass the plastic and gas. During this wait, we give him medications to help this process and make him more comfortable. In addition to the pain, his floating is very stressful for him, so we need to help him swim more comfortably. So how do you make a turtle sink? Well, we made pouches out of wetsuit material and velcroed them to the back of his shell. Weights are placed in the pouches to help counterbalance his floating so that he can dive down to the bottom and swim more comfortably. As the gas improves over time, the amount of weight can be adjusted until he no longer needs it. Do you see the difference in his swimming? He is much more comfortable near the bottom of the tank as opposed to floating up at the surface doing headstands, as we saw before. Do you see another toy? The white domed thing in his tank is another type of enrichment device. That is Edward's hide. The hide is made from PVC and lattice material to create a house. In the wild, turtles like to hide in the crevices and shelves in the rocks and the reefs to stay safe from predators. Edward uses his hide to feel safe, but also for a little extra support to keep him on the bottom. After many weeks of support, Edward successfully emptied his intestines. We collected 78 pieces of plastic material from his stool. The plastic pieces included things like plastic grocery bags, plastic wrappers, pieces of duct tape, and other things that we couldn't necessarily identify other than the fact that they were plastic. We laid them all out on the table. You can see Liam's feet in the picture, which helps give you a reference point to appreciate the overall amount of plastic that was in Edward's belly. Edward was a very lucky turtle to be rescued and receive treatment before the plastic created a blockage and more serious complications. Now, let's take a walk over here and visit Miss Delta. Delta came to us in September of last year. Delta 2 has fibropapillomatosis, as most of our patients do here, but she also had a severe fishing line entanglement around her front flipper. Delta is a female juvenile green sea turtle, about 3 years old. As you can see, Delta absolutely loves her hide. She spends most of her day either resting in it, scratching her back on it, or rearranging it to the perfect location in her tank. You probably have noticed in many of our tanks that there's some algae on the floor and on the walls of the tank. It's not because the tanks are dirty. We leave that algae there on purpose because it helps keep their water balanced and healthy. The tanks are scrubbed daily to clean them and remove the unhealthy buildup. Maintaining a good balance of healthy algae and bacteria helps keep our turtles healthy and allows them to heal faster. This is how Delta looked upon her arrival. She had multiple large FP tumors and fishing line wrapped tightly around her left front flipper. The fishing line was very tight and had been tangled for quite some time before she was rescued. The line cut off the circulation to her flipper, causing a severe amount of damage. Sometimes the flippers are damaged beyond repair and require amputation. We were initially very worried about Delta's flipper, but luckily, with a lot of treatment and physical therapy, her flipper was able to heal. This is the line that she got tangled in. There is a lot of monofilament line connected to a leader with some sinker weights and a hook. Amazingly, 6 months later, Delta is happily swimming with 4 healthy flippers. So as you can see, we do a lot here to take care of sick and injured sea turtles. I love my job as a veterinarian. It is the most amazing thing when we get to return these guys to the ocean where they belong. But it's not just me. I need your help. There is so much that you can do to help these turtles and our oceans. And guess what? Your job is easy. It's not nearly as complicated as surgery. Just be a good steward. Take care of your community and be responsible. I'll teach you how. It's all about being a good steward, making good choices, and taking steps in our everyday lives to reduce plastic waste, litter, and pollution. It all begins with the easiest task of putting trash where it belongs. Just don't litter. If you visit the beach or a park, Don't leave your trash behind. Leave nothing but footprints. This is close enough, right? No way. Trash that is left on the ground gets blown by the wind or carried by water into storm drains, which empty into our rivers and oceans. So to help protect turtles like Edward, make sure trash goes into the trash can. Even better, let's focus on the 4 R's: reduce, reuse, recycle, and refuse. With this, we can decrease the overall amount of trash. When we throw things away, they pile up in landfills and sit for many, many years, and sometimes forever. Some materials will never go away. So this is where the creativity and fun begins. We all know about recycling. This is a very important step to help reduce trash. However, what you might not know, particularly with plastic, is that there is too much plastic in the world to be recycled. We make and use more than could ever be recycled. The goal is to always be thinking, can I use something else? And can I use it again? My favorite thing is reusable water bottles. Did you know that over 100 million plastic water bottles are used each day in the world? Only about 20% of them are recycled. So by choosing refillable water bottles and refillable cups, you are reducing a lot of plastic. By yourself, you can eliminate 1,500 plastic bottles a year. Here's another easy one. Skip the straw. There are over 500 million plastic straws used per day. There are so many different fun kinds you can choose from that are reusable. Some are still disposable, like paper and pasta and some other new creative things. Some are metal, some are silicone. There's all kinds you can find. Another big, easy choice is to choose reusable shopping bags. 1 trillion plastic grocery bags are used every year. Reusable bags not only help reduce our pollution, but guess what? They're more convenient. You can carry 4 times the groceries in one bag, which means less trips from the car when you're unloading. It's a win for everyone. Remember Eugenie and Delta? They would love for you to be a responsible fisherman. There are convenient containers on many beaches, docks, and piers for disposal of fishing line. This helps prevent our turtles and other wildlife from becoming tangled. Another bonus is that the line is then recycled. If you are on a boat or in an area without a receptacle, don't worry, it's easy to make your own. Our 4-H club makes fun containers from tennis ball cans. This not only reuses the container, which saves plastic, it also collects your knotted fishing line. It can be clipped to your tackle box and taken anywhere you love to fish. As you can see, there are so many easy, good choices you can make to be a good steward. With all of these things, you too can help save our turtles and our oceans. I had a lot of fun today, and I hope you had fun too. Thanks so much for watching. I really enjoyed giving you a tour of our hospital and teaching you about some of our patients and what we're doing here at the Sea Turtle Hospital to help the sea turtles in our oceans. And I look forward to seeing you be a good steward in the community to help our sea turtles. Bye.